More than half of those diagnosed with COVID-19 will experience what's known as long COVID or long haul COVID, an extension of symptoms beyond the original diagnosis, a major setback for those trying to return to their jobs. Let's welcome back Dr. Anthony Harris, CEO and Medical Director of HFit Health, and he's here to share more on how this is affecting the workplace. Doctor, it's great to have you.
Thanks for having me. My pleasure.
What is the latest on long COVID? You know, we're hearing that there could be an additional wave because of Omicron. So can you tell us a little bit more about what we should expect?
You bet. Thanks for having me. And we are and potentially will see individuals experience long COVID, not just as a result of Omicron, but what we've seen happen since the beginning of the pandemic. And the big concern with Omicron is that, it's estimated over half of the U.S. population will be affected by Omicron. And if we look at the statistics on long COVID, which is defined by, here in the U.S., symptoms beyond 4 weeks, right, after your recovery from COVID. And we're talking anywhere in terms of a myriad of symptoms from shortness of breath, fatigue, muscle pain, weakness. One of the biggest symptoms that people are concerned about is the brain fog, right? The cognitive difficulties. And that's what may be preventing up to 1.6 million workers from preventing them from coming back to work in the U.S. right now. So it's a staggering number, a staggering impact, and it's something that we may see balloon after Omicron.
Yeah, that's a little bit frightening. Do we know anything more, though, about who this affects? Because I know that there were some studies done and something that has to do with the gut and the microbiome within the gut, that might indicate who gets long COVID. Can you tell us a little bit more about if there's been any findings in the last year?
Yeah, we know that the gut plays a major role there. Our gut is one of our largest inflammatory as well as largest immune system organs in our body, right? Our skin, our gut. And we know that movement of bacteria in our gut plays a role in inflammation. Even in the ICUs, we give probiotics to individuals who are gravely ill to help them with their inflammatory processes because it's modified by the gut. And so we know that there may be a strong component there. We don't have enough evidence to say for sure what predisposes someone to long COVID, but we know that it is an inflammatory cascade. We know the gut may play a key role, but we also know that the effects on the blood vessels may be key and central to who experiences long COVID, because it's the end organ impact that we see from the brain, from the heart, and other parts of the organs that are critical.
Are we hearing from the first wave of those who did experience long COVID that any of those symptoms are subsiding, or are those people still suffering from the same symptoms that they've been experiencing this entire time?
Typically, once you have a set of symptoms that is persisting beyond your acute episode of COVID, it may persist and not so much switch between different types of symptoms. Now, there is a myriad of symptoms, right? As I mentioned, WHO published a paper on long COVID, and they looked at over 18 symptoms, some of them being more common than others. And individuals who experience it, unfortunately, will have waves. And so it's not that the symptoms particularly change, but they may have a week or two where the symptoms are minimized. And then they try to go back to work, and all of a sudden their fatigue comes back, their shortness of breath comes back. And that is one of the key features to long COVID, unfortunately.
So what is the workplace to do? Employers, employees, how are they going to get through this?
Sure. So we're counseling employers nationwide that you have to have a plan in place, because we know there will be instability in the workforce. I mean, obviously, every employer in the U.S. right now and globally is experiencing shortages. We know that there should be at least 1.6 to 1.9 million more individuals participating in the workforce than they are today. And long COVID may point to that. And if you have a plan in place that allows you to accommodate for these workers, then you may be better off as an organization from a productivity standpoint. And we're talking short-term disability, we're talking FMLA, we're talking, those type of instruments that can be in place to help ease the transition as someone is dealing with long COVID back into the workplace without going full throttle, right? The key is that, these individuals may not be able to endure the 8-hour day or the 10-hour day that they used to because of their symptoms.
And any advice and any resources for people who are experiencing long COVID, if they are faced with a workplace environment that is insisting that they return to work and don't have any of these options in place, where can they go to find out more information to protect themselves and their own employment?
Absolutely. Start with a physician that hopefully is learned about long COVID. We in the clinical community need to do more to understand and digest what are the symptoms, how does it present, and diagnose it. But certainly starting there with a physician that can assist you in evaluating, yes, do you have long COVID or no? Could it be something else is key. And then the next step thereafter is then evaluating, do you meet the criteria for short-term disability? And that's what we do day in and day out here. And it's definitely something that we will see a deeper need for as we move forward.
Dr. Harris, thank you so much. A very busy man. He's coming to us from the road. I want to thank you so much for joining us.
Absolutely. Thanks for having me.
We're back after this.